Welcome to another Coffee and Cases. We're gonna get started, and whoever joins in late can just catch up and carry on with us. Today's Coffee and Cases is presented by Lenmet. So we're gonna have Renee Ackerman just doing a short intro. Her title is she's the head of the group at the Trauma and Emergency Department at LenMed. She is also involved in the transplant department as well. And then we have the rest of the presentation is by Mike Embrich. Please remember that this is an open space. It's a space for all of us to share our opinions and get involved. There's no hierarchy. Can we please respect everyone when they're talking and keep our mics muted at all times? So, Renee, whenever you're ready, you can take it.
Good morning, everybody. I'm just testing my sound. If you can hear me.
Yes, we can.
Thank you. So, good morning to everybody that joined this training session this morning. So I just would like to use this opportunity to introduce LenMed to all of you. So LenMed turned 40 years old last year, and has started at a very small beginning in 1984 in Lenasia with the then Lenasia Clinic, established by doctors from that community. And ever since 1984, we've grown to be the largest independent hospital group in South Africa, and currently own or co-manage about 2,000, just over 2,300 beds across hospitals in South Africa, Botswana, Mozambique, and Ghana. We employ over 3,000 people, and really aiming towards being the employer of choice in the healthcare sector, with a growing presence on the African continent. So to show you more about where our hospitals are, for those of you who are not aware, we have 14 facilities in South Africa and proudly opened our first rehabilitation facility at Lenmere eThekwini Hospital that manage both trauma, stroke, cardiac, any rehabilitation need of an adult patient. We have one facility in Botswana, two hospitals in Mozambique, one in Maputo and one in Beira, and then the Bank Hospital in Accra, Ghana. Just see if the slide wants to move. Okay. So just a little bit of soapbox moment and celebrating our accreditations over the past couple of years. So very proudly in 2022, Lenmere eThekwini Hospital and Heart Center received the American College of Cardiology accreditation for chest pain and primary PCI center, which are working really, really hard at maintaining every year with the audits. Over the years, several of our Lenmere hospitals received the best performer according to the Discovery Quality ratings. We've done bariatric surgery accreditation at our hospital, Ahmed Kathrada in Indonesia. Various of our hospitals have achieved the COSASA accreditation. We started with Trauma Society accreditation in 2023 with Lenmere Randfontein and Shiva Private Hospital achieving trauma accreditation in 2023. And then I think eThekwini really standing out as a stroke center and has now achieved 8 consecutive diamond status awards by the WSO, SO and Angels. So really creating what we're trying to do is centers of excellence in providing the best care for patients that come to our facilities. More recent accreditation is that Lenmere Bokamoso, that is our hospital in Botswana, was also awarded the American College of Cardiology Heart Failure accreditation. That followed Lenmere eThekwini receiving the Chest Pain Center accreditation, primary PCI again. I did mention all our angels, the WSO Stroke Awards. I mentioned that you're receiving 8 consecutive diamond status, and that just shows you it's easy to achieve a first-time accreditation, but the hard work and excellence come into doing it quarter after quarter after quarter, and remaining that first promise that we made to the patient with our first accreditation is continuous as we move to new quarters. We're very proud of our little hospital, Shifa, that in the very first quarter that they've applied for Angels Review, received diamond status. And then Royal Hospital has also had 4 consecutive awards. Our hospital in Botswana, we're the first hospital outside the borders of South Africa, awarded level 2 trauma center accreditation by Trauma Society. And our aim is really through doing all these accreditations, it's not to have the certificates on our wall, but it's a promise that we give to our patients to really provide the best care that we measure against international standards and improving patient outcomes. Focusing on Lenmed eThekwini specifically, you can see there their centers of excellence is the stroke program. We have a huge focus on cardiology work for both the adult as well as pediatric population. We recently got a certification for our TAVI program. We do the cardiothoracic transplants and also now living donor renal transplants. We're working hard towards accreditation of eThekwini by the Trauma Society as a trauma center. And I'm sure you're going to see more and more of us in that platform. We have multiple pediatric subspecialties doing robotic arthroplasty and is also moving towards more oncology and specific focused oncology work. And all of these programs are supported by the rehabilitation center that we opened. The rehabilitation center is not only for eThekwini, we do also accept transfers in from other facilities. I want to end this quote by really sharing this with you, and I think that is what we're aiming to do in any patient pathway that we follow. And I'm going to read it to you. The names of the patients whose lives we saved can never be known, often to be what did not happen to them. And though they are unknown, we will know that mothers and fathers are at graduations and weddings that they would have missed, and that grandchildren will know grandparents they might never have known. And holidays will be taken and work completed and books read and symphonies heard and gardens tended that without our work would never have been. And that's what we're really aiming for, is just to change the outcome for every single patient that we have the honor of managing at Lenmed. So that's really just a brief introduction of what we believe in, what we're aiming for. And I'm happy to take 1 or 2 questions if there's anything from the audience. I think I've lost my signal there. I don't know how far you've heard. To get to the end.
Hi, Renee. So the audio was a bit broken at times, but we did get the whole presentation.
Thanks, Brian. My apologies. I'm in between meetings, so my apology for the background noise also. If there's no questions, I'm happy to hand over to the speaker.
Thank you, Renee. Mike, if you are ready, you can go ahead with your presentation.
I'm ready. Thank you. Let me just quickly share that screen. Okay, good morning, everybody. Am I coming through loud and clear? 5 out of 5.
5, Mike, thank you.
Right. Okay. Once again, thanks everybody for joining this morning. Much appreciated. And this is a continuation of one of the presentation from the other day. One of the first of a number, as we said. And this really is just to give us a detailed overview and thorough understanding of the mentorship program. Excuse me. And just for us to understand where the mentorship program sits and how the whole program works, and for us to slowly start empowering and educating everybody who's in on the call today about the importance of mentoring and working collaboratively within the industry. So in terms of our introduction as to where we are and where the program is at the moment, we do know and we all understand that healthcare is a field that demands continuous learning and is also a demanding field as well. And tied in with that, we're looking at building strong professional networks and professional relationships through this process, whereby both parties, well, all parties involved can benefit. Effectively, corporate structures, patients, management, the mentors and the mentees, and really just giving a heightened clinical governance to the whole program. So that's where mentorship comes in. And also, it's very important to understand, and we reflected on this the other day, that there's many elements to mentorship. So it's a way of sharing between the two people who are in the mentor-mentee relationship. That's how they can align their thinking and how they can then connect with other healthcare professionals. And bearing in mind, when we say we're looking at mentors coming in, all of us as mentors are at all times learning. We're not subject matter experts in being mentors. We might be subject matter experts in being other areas of EMS. So it's an opportunity for all parties to look at new, fresh perspectives, opportunities for growth, have a successful shared journey. And part of the process in the shared journey, excuse me, is that both parties will benefit by this. So, and it's a very personalized process that we're going to work through now as to how the program knits together, how we pair people, how we partner people, and also how the mentee themselves has the ability to take ownership of the process. If I see any messages pop up in the chat box while I'm presenting, I'll reflect to the messages in the chat box as we're moving through as well. So currently where we stand, we're looking at 28 mentors. So far there's 21 mentees, and we've matched 14 mentors met with their mentees, and there are still mentors available to be matched as well. In terms of the numbers of mentors who can mentee and how many mentees can be aligned to one mentor, that's the whole process that as a collective group, we're still busy becoming to understand based on the demands and based on, because bearing in mind all parties are working as well. So that whole balance, it will be unpacked and uncovered as we move forward through the process, as we develop the program, and also at the same time, the development of the program will involve training, coaching tools for both parties in the process, so that we can all be focused as to where we are moving forward and going to in terms of the importance of having this mentor system. We also need to understand that within South Africa, this is a totally new concept and a new understanding of where we're going with this within emergency medicine. So it's an area of work that hasn't really been actively done at the level that we are attempting to embark on it here. If we also look back at the mentees in their feedback forms, which they submitted when they were applying to be part of the process, we look at the comments that they made, the things that were important to them. So as we can see, accessibility, experienced in terms of both sides of the network, a supportive, dynamic, collaborative framework, constructive and engaging, and motivational. And for those of us who've worked in a coaching mentor framework will know that the motivational aspects of this and the encouraging aspects of this lie on both sides of the table, that both parties are encouraged by this and learn through this process. So these feedback points are very important for all of us to take cognizance of, because it helps to guide us where we're going, and also helps to see that what the people who want to be mentored, what they're looking for. And we can see a lot of those elements that we're looking at there, and we'll reflect back on this in an upcoming slide. They relate a lot to more soft skills than hard skills, and that's critical for us to understand. So what can we expect? What can all of us expect out of this? And also, most importantly, the comment on the side there is, if we want to see different results, we need to start doing things differently. We can't keep doing the same thing again and again and expect a different outcome. So part of this as a profession and as a career is to facilitate meaningful professional connections, where we can create an environment where healthcare professionals can form supportive, growth-orientated relationships. And that's very critical that we look at that as a profession. If we can move in that direction of having growth-orientated relationships, that would be a phenomenal profession to just wallow in and enjoy. And encourage open knowledge sharing, so we can provide a platform where experienced professionals on both sides of the table can share insights and best practices, and how you can grow your career through that knowledge sharing. Intellectual knowledge capital, we should really not look at hogging that, especially experienced elderly practitioners, and be willing to part with that. And a lot of the younger generation medical people coming in might not have learned some of the grassroots ways of doing things, because most of us are very techno-driven these days. So part of that is in supporting career development, helping everybody navigate career challenges, and help people to set meaningful professional and personal goals. And I think it's very important that we look at the goal setting. Should be not only professional but personal, where we can then, part of that would be creating a culture of lifelong learning and encouraging continuous educational development and personal development, so that we stay adaptable, well-informed, and really in a dynamic mind and workspace. And then the last point there, enhance well-being and resilience. We reflected on resilience the other day, and we'll be reflecting on resilience in 1 or 2 sessions coming up in the next month or so, where we provide a safe space where we can discuss our challenges, gain perspective on what we're doing, and move towards helping to prevent burnout or minimize burnout. There always will be the risk of that, but we can at least minimize and reduce those risks as well through this process. So the aspirations of this, what do we aspire about this? What do we see? Where do we see this going? And which is really looking at an organically growing program that just thrives across. When I say EMS network, it's anybody involved in emergency medicine. It doesn't have to be in the pre-hospital space. It could be in the in-hospital space. It can be doctors, nurses, first responders, people working in fire and rescue, where everybody is working together collectively, organically, because we're all there for the same reason and we all face the same challenges. So this thriving mentorship community that we build would be a whole network of professionals across the broad spectrum, and even across the boundaries and borders of our country into other areas. Many of our colleagues have moved offshore, and they are part of this family, no matter where we are in the world, this family of emergency medicine practitioners. And we can just, through this diversity of experience, this diversity of our different work sectors and different challenges, we can help across multiple healthcare disciplines. We can attract mentees and mentors into this whole process of broadening a range of insights and experiences through the whole process. And then also over time, developing a structured resource and support network and support center, really, where we can look at reinforcing guidelines, training materials, and discussion forums outside of these frameworks that we're currently looking at, having other different chat networks where we can look at how we can establish a robust standard in healthcare development. We are in the position, and we are in the space where we can shift the paradigm and really make this a vibrant, challenging, thriving process. So how do we do this? Yeah. So we pair you with a mentor. So we have mentees who've submitted. We pair you with a mentor, or you could put in a request to be mentored by someone within the group. Some of the mentors are on the call today, and they'll be given an opportunity to introduce themselves as well. So once that network is set up, we share contact details, and then the two of you start your mentoring journey. And it's a private, confidential journey based on a bond of trust going both ways. So as a program, we know who's paired with who, but we don't know what the parties speak about, and there's no feedback in terms of hard data, what the personal details that's been shared. That's the trust that's built between the mentor and the mentee, and that trust is an important bond that stays rigidly solid, that confidentiality, to know that both parties can openly share as they walk this journey together. And that process will then be both empowering and enriching. And speaking for myself, who has worked in coaching and mentor programs outside of emergency medicine, they are thriving and stimulating environments and relationships to be in, and bonds that you build up in these processes, you will have these bonds and connections for years, and friends will be grown out of this, and friendships will just be strengthened. Importantly, if we look at the needs analysis, as I was reflecting earlier, we can see that, looking at the on the far left-hand side, research, leadership, education, strategic planning. But we look at the center section there, career planning, work-life balance, future planning, emotional and mental health improvement, dispute resolution. A lot of stuff there relates to the soft skills as opposed to the hard skills. And both of those environments would be within the mentor space. So some people would be looking maybe more on the blue and the purple side. Others will be looking more in the soft skills center. But we can see there's a large batch of people within the mentor system who are wanting a mix of both. So, and it's important that those of us who are sitting here, no matter where we're positioned in our work structure, that we should be looking at this. If you're an emergency manager, if you're a base manager, if you're running a small private ambulance service, if you're working in a training college, If you're working as a colleague and you have other colleagues alongside you, we should be looking at these as managers, leaders, educators. We should be looking at this is what the industry, this is what the people are looking for. And what the people want, we should be able to deliver that, not only within the mentor-mentee space, but both in our professional, personal environments, back in the workspace. So, and sitting as we are now, this puts all of us, every single one of us is sitting here today, it puts us in a privileged position, which will only benefit the industry in the short and the long term. So what we can do here, could have a ripple effect across the industry. And that ripple could grow into a tsunami of change of how we go about dealing and managing our workspace and our educational space, our management space, and also our patient care space. So who benefits? So the mentor will benefit because the mentor will be encouraged and will have to look at life from a different perspective, from the perspective of the mentee. The mentor will be sharing knowledge and learning in the process. The process of sharing knowledge is in itself a learning process. And the ability to see growth in somebody else gives satisfaction to you and growth to you as well. It gives you an emotional feedback. And being a mentor means having the ability to be, and the empathy to be a mentee as well. So, and some of you might be familiar with the writings and the readings of Simon Sinek. If you're on LinkedIn, he's prolific in that area, and on YouTube. And a mentor, as he says, is not someone who walks ahead of us to show us how they did it. A mentor walks alongside us to show us what we can do. And the stress is what we can do together, side by side. So that's really significant that we look at that and we ponder on that, on how we can really make a significant difference to our profession. Excuse me. The mentee, the note at the bottom is also very important, that we reflect on that the mentee drives the mentoring process. It's the mentee's journey. It's their process. So enjoy it, thrive in it, revel in it. You have an opportunity to learn and grow during the process, inside and outside of EMS. It'll help you in your personal space in terms of confidence and the resilience to deal with some of the things that you're focused with. And at the same time, you'll be learning different perspectives and getting a chance for professional guidance, personalized development through this relationship process that you're growing and building through this growth mindset. And a growth mindset is critical. The way that we grow is through a growth mindset, by stretching our mind. So if we find out what we want and how we can learn to grow, this mindset allows us to thrive during challenging times. It gives us a passion for stretching ourselves, especially when it's not going well. And those are the hallmarks of a growth mindset, where we get results, we feel good, and most importantly, we develop a can-do attitude. New goals, new optimism, and we can achieve more. Who else benefits? The healthcare industry. So in other words, the companies we work for, the corporate network, but also more importantly, our patients benefit. And all of us are here because we actually care about our patients. And I couldn't find any studies on EMS in terms of mentoring, but nurses, the mentoring relationship, they found that their problem-solving abilities have been improved by up to 55%. So our patient care will improve. our workforce, our colleagues will be more empowered and feel more confident. From a work ethic perspective, we can increase job retention, job satisfaction, and also, more importantly, through this process, we can have more empathetic leaders, managers, and colleagues, where we can then focus that all people within the network and the framework are going to be becoming more empathetic, more caring, and more understanding of this whole learnership mentoring dynamic. Okay, so who are our mentors? Who are they? I don't know how many of them are on the call, Cobus, and how many are able or wanting to introduce themselves.
Well, thanks, Mike. I'll give it a bash and see where we end up. Hi, everyone. I'm Cobus. I administrate the mentorship program. And for me, mentorship is having a soundboard that is uniquely qualified to understand, because not everyone understands our industry and what we go through. But everyone in our mentorship program is probably has been or is feeling the way you are feeling today. So you are not alone, and it's a good place to get some advice. Are there any other mentors that want to say hi?
Thanks, Cobus. I suppose I'll also quickly say hi. I'm also one of the mentors. So there's two of us in the Rogues Gallery who've put their hands up at the moment.
Should I go?
Yes, Karin, please go ahead.
Good morning, guys. My name is Karin. I'm a registered nurse who have been a fixed wing flight nurse for many, many years. So I represent a smaller population, I'd say. There's not a lot of us in this environment. That's why I think it's so important. But my big passion is resilience and how do we help each other to be more resilient in this specific environment. So my background is more fixed wing, but I do some rotary wing with rockets, specifically as an observer during the colder months. Yeah, and I am very keen for it. As much as I feel like it's something that I would help someone with, I'm very keen on learning out of it as well. I feel like it's the same relationship I have with my patients. As much as I help my patients help me. So it's a hand in hand, like we walk together, exactly like was mentioned earlier. Thanks for the opportunity, Mike.
Only a pleasure, Karin, and thank you for your service.
Tetwa, your hand is up.
Hi, everyone. I am Malu Singh Tetwa. I'm from KZN. I was born in Mbangeni. Currently, I'm in Australia. I'm a registered ECP. I've worked in South Africa a lot. I've worked in the Eastern Cape, Port Elizabeth, Tata, and I've worked in Durban, in Anzimdoti Kingsway Hospital. And here in the UAE, Qatar, and now I'm in Australia. I've been here for about 7 years. I do have interest in research. Did my master's. Now I'm pursuing a PhD. I have a strong interest in mentorship. I think the program that I found here in Australia was a bit different. Something that is mandatory that a person has to have mentorship after they finish their degree. I think there's a lot of research too that is coming out of South Africa too that talks about mentorship. If you look at it, when you finish your degree, you're given the keys and the vehicle and you drive fast, and you have these dangerous drugs that you have in there. And these dangerous drugs, you have to manage them, you need to treat patients with them, they're lethal, and you have to manage stuff, and sometimes you have to be a team leader and all that. And we never had people to bounce ideas to and to share what we think or our realities and the hardships that we're experiencing. I think I've seen a whole lot of that. I think I had that too. So my idea is that if anyone wants to have a person to talk to about such issues, I think that's what mentorship is there for. In my spare time, I'm also a podcaster. There's a platform called Para Podcast where we talk about paramedicine and other things that are related. Yeah, if anyone is interested in being mentored by someone that is out of the country or that is a South African at heart fully, I am there. Thank you.
Thank you, Malusi. Debbie, please go ahead.
Hi, Kobus. Hi, Mike. Thanks for the opportunity. So my name is Debbie. I'm based in Joburg. I have a different career path to most paramedics or ECPs out there. I started off as a nursing sister. And when I got tired of listening to doctors, I chose to get my own scope, so moved to becoming an ECP. Completed my master's and pursuing my doctorate at the moment. I work mainly in fixed and rotary wing flight services. And my full-time job is in education. So I do a lot of teaching in emergency medicine, but I also have a keen interest in research. I thoroughly enjoy it. And the more I learn, the more I realize how little I know. So thanks to everyone for this opportunity. It's a brilliant opportunity for us to all grow within the field. Yeah, and I'm eager to support anybody who needs some support out there.
Thank you, Debbie. Are there
Thank you,
any
Debbie.
other mentors on the platform today that want to say hi? It's a fair point. We're not all talkers.
Yeah. Okay, well, let's move on then.
Yeah, let's go ahead, Mike. Do you have any
Thank-
closing remarks?
We've got 1 or 2 slides left. Right, so yeah, and I don't think I need to introduce myself because all of you were on the call about 3 weeks ago when I introduced myself at length. So I think most people know where my area of mentorship is, and it's in the warm and fuzzy part of mentoring. So let's have a couple of closeout thoughts. So let's shift the paradigm. To paraphrase the late great John F. Kennedy, ask not what your profession can do for you, but rather ask what I can do for my profession and my colleagues. And that's what this is all about. Mentoring and what we're building here, the culture that we're building here is all around that. What we can do for our profession and for our colleagues, as opposed to waiting for somebody else to do it. Because nobody will unless we do. So let's take the opportunity to do that. And also remember that those who are entering the profession now can see further because they're standing on the shoulders of those who came before. And those who came before should allow those who are entering the profession to climb up on our shoulders to see beyond where we have traveled and beyond what we can see, so they can see more and see further. So that for me would be one of my personal dreams and visions of this program and process. So, well, who's going to be signing up now? So there's the same link that you'd use for the CPD register, and you'll scroll down to the mentorship program on that. And then you can click on to become a mentor or a mentee and complete the form and submit it. And we look forward to seeing as many of you in the system as we can, to encourage and help everybody to really make this profession the caring, empathetic profession that it can and it should be, that we care for the person who stands next to us as much as we want them to care for us. Thank you again. And well, the floor is now open for open questions and discussions.
Morning all. Thank you for the talk and for the topic. And I think this is a really, really great first step for our industry. And this has awoken a thought that I've had for a couple of years as well, is that I wonder if in the long run, this might lead to or can possibly become something that becomes more formal, as the gentleman from Australia mentioned, that it is compulsory down there. But just the thought that I've had for a few years is that, and maybe someone can answer me or from the audience or yourself, but I wonder why EMS has never gone into the government official program of community service and mentorship and that direction. And that is something maybe that this program in the long run can maybe reach or take part in or touch about, where you have new qualified staff. They come into the service, they start at a government service, work where the patients with the most needs is, and possibly have a formal mentorship program that develops. And then from there on, they can then branch out into different parts of the industry. Just a rough thought, and would like some comments on that.
Well, thank you, Estienne. I don't have answers to all of your questions, but I do agree that this is long overdue. I mean, as somebody has been reflected in the past, that many of us who've been in the profession for many years would have loved to have something like this when we entered the profession. So I think we can look at changing that now, and I agree this is significant. For it to become more formal or structured or compulsory, the formal and the structured I would definitely concur with. Compulsory, I think that might take, I don't know, some of the magic out of it and the passion out of it. But I do agree that we should definitely find ways to get more and more people into a mentor-mentee system.
I wanted to comment on Estienne's comment just now. Willem, I don't know if Willem is on the call, but he reached out a while back and we were talking about exactly that sort of, I don't want to say make it or make it a priority as part of it. And like I mentioned earlier, my big passion is in resilience. So how do you make that part of the curriculum or part of a framework that is part of your curriculum when you train these people? So there's definitely talks about it. So I'm glad that there's confirmation that people feel how passionate about it and feel that it is very valuable. So yeah, I just want to say, watch the space. I think it's definitely something it'll become, not maybe compulsory, but something that's definitely a suggestion.
Thank you, Corinne. Yeah, I do agree that, the more and more people buy into this, the more and more people who come on board, it'll organically grow because people who are in the program will see the benefit. There is such a huge benefit to being in a mentor-mentee, coach-coachee program, and they will see the benefit and people will talk and it will organically just snowball, I believe.
Good morning, colleagues. Arthur Malchas. I just wanted, I'm not by no means trying to speak on behalf of government or the Department of Health, but I just wanted to I think there was a comment about the community service and EMS being left out for so many years. We've been raising this same questions in my areas of research interest. I tried to explore that, and I'm aware of a whole number of EMS-based research that's coming out on this. However, one of the things that we've learned is that the issue of community service is actually a government gazette regulation that was promulgated by the Minister of Health some years ago. I think the last time it was amended could potentially be under correction to the year 2002. So the gazette lists categories and professions or areas that are required to complete community service, and those then had to register with the Health Professions Council. So the issue is being listed in the regulation, and we have also learned that since the inception of this community service, there were many dynamics, challenges, some of them financial, some of them non-financial, that are making it apparently difficult to continue expanding the list. But it is something that is currently being, I'm aware, it's entertained, it's discussed at the National Department of Health, etc. So I just thought I could share just that little bit of that. Thank you so much.
Thank you for your insights from that side, Arthur. Much appreciated. Much appreciated. Thank you.
In the absence of any further questions, the link for the register has been posted in the chat. If you can please just try and open that in Chrome, and then the word for today is mentor. Thank you so much to Mike and Renee for your lovely presentations, and we look forward to seeing you guys in the mentorship program.